Today, let's talk about the silent signals of a heart attack that women often miss. In the United States, heart disease is the leading cause of death for women, yet most don't recognize the crucial warning signs. According to research published in Circulation, a striking 95% of women experience warning symptoms in the weeks leading up to a heart attack. However, these symptoms are often so subtle that women consistently dismiss them, attributing them to stress, the natural process of aging, or minor health issues. This oversight is tragic, especially when considering that heart disease claims more women's lives than all cancers combined. And women are far more likely than men to miss these early indicators. This isn't due to a lack of medical knowledge, rather, it's because women's heart attack symptoms are fundamentally different from what we've traditionally been taught to expect. Before we delve into these potentially life saving symptoms, if you're new to our community, welcome. We're dedicated to safeguarding women's health. Please take a moment to hit that subscribe button and activate the notification bell so you never miss out on content that could, quite literally, save your life. We'd also love for you to drop a comment below and let us know where you're watching from. It's wonderful to connect with viewers worldwide who are actively taking charge of their health. This video aims to completely transform your understanding of heart attacks in women. These 9 silent symptoms are incredibly subtle, easily brushed aside, yet so deadly that recognizing them could be the crucial factor between life and death. Now, let's explore this list of silent heart attack symptoms that women frequently overlook. Starting with symptom number 1, unusual fatigue. That overwhelming exhaustion you've been blaming on your demanding schedule might actually be your heart signaling distress. This isn't just typical tiredness, it's a debilitating fatigue that makes even simple tasks feel overwhelming. A pivotal study published in Circulation followed 515 women who had experienced heart attacks, and the results were astonishing. 70.7% of these women reported experiencing unusual, overwhelming fatigue in the weeks leading up to their cardiac event. Dr. Jean McSweeney from the University of Arkansas for Medical Sciences, who spearheaded this groundbreaking research, found that women described feeling so tired they couldn't even make a bed without needing to rest, or were too exhausted to prepare dinner. When coronary arteries narrow due to plaque buildup, your heart is forced to work significantly harder to pump blood throughout your body. This increased workload impacts every cell reliant on oxygen rich blood, leaving you feeling completely drained. This symptom is particularly dangerous because society has often conditioned women to accept exhaustion as a normal part of life. This fatigue is characterized as unexplained, often interfering with daily activities, and isn't relieved by rest. It isn't proportional to your activity level and frequently comes with a persistent sense that something fundamental has changed within your body. If you're experiencing unusual, persistent fatigue that can't be explained by lifestyle factors, especially if you have other risk factors for heart disease, this could be your body's critical early warning system. Next, symptom number 2, sleep disturbances. Problems with sleep before a heart attack aren't solely due to stress. They represent your cardiovascular system urgently calling for help. Research indicates that 47.8% of women who experienced heart attacks reported sleep disturbances in the weeks or months prior to the event. A study published in the Heart and Lung Journal found that among 1,270 women experiencing their first heart attack, 632 reported new onset or worsening sleep disturbances before their cardiac event. These aren't just ordinary sleep issues that millions of people encounter. Women describe lying awake with a sensation that their heart is working too hard or experiencing an inexplicable restlessness that prevents deep sleep. Some report waking up feeling unable to breathe properly, while others find themselves inexplicably alert during hours when they should be in a deep slumber. As coronary arteries become blocked, your heart struggles to maintain adequate blood flow during periods of rest. Your nervous system, sensing that something is amiss, keeps you in a heightened state of alertness. This isn't a conscious awareness, it's your body's primitive survival mechanism keeping you awake because it detects underlying cardiovascular stress. When sleep disturbances are linked to heart problems, they exhibit distinct characteristics. They feel more intense than usual, may be accompanied by sweating or shortness of breath, and do not improve with typical sleep hygiene measures. Moving on to symptom number 3, shortness of breath. Feeling winded during activities that never bothered you before isn't simply a sign of being out of shape. Research reveals that 42.1% of women experience breathing difficulties in the month leading up to their cardiac event. Interestingly, shortness of breath is twice as common in women as in men before a heart attack, yet women are significantly more likely to dismiss it as nothing serious. This isn't a dramatic, gasping breathlessness. Women describe feeling like they can't get a full, satisfying breath, even when sitting still, or needing to consciously think about breathing, something that should be completely automatic. Activities they once performed effortlessly suddenly leave them feeling as if they've completed strenuous exercise. When coronary arteries are blocked, your heart cannot effectively pump blood throughout your body, meaning your tissues aren't receiving the oxygen they desperately need. In response, your brain triggers faster, shallower breathing to compensate. However, no amount of breathing can fix a heart that isn't pumping efficiently. Heart related breathing problems worsen with minimal exertion, do not improve with rest, like exercise induced breathlessness, and may be accompanied by fatigue or chest discomfort. What begins as mild breathlessness can progress to difficulty breathing at rest, making early recognition absolutely critical. Next, symptom number 4, jaw, neck, or back pain. That persistent jaw ache you've attributed to teeth grinding or the neck pain you've blamed on poor posture might actually be your heart crying out for help. Research demonstrates that women experiencing heart attacks are far more likely to report jaw, neck, or back pain as their primary symptom compared to men. This isn't a sharp, localized pain from an injury. Women describe a deep, aching pressure that radiates from somewhere they can't quite pinpoint. Some report feeling like they have the worst stiff neck of their life, or jaw pain that feels as though they've been clenching their teeth for hours. Your heart shares nerve pathways with other parts of your upper body through the vagus nerve network. When your heart muscle is deprived of oxygen due to blocked coronary arteries, these shared pathways can cause you to feel pain in areas that seem entirely unrelated to your heart. It's essentially your body's wiring system getting signals crossed during a medical emergency. This pain often comes and goes, leading women to dismiss it as stress related tension or minor injuries. Women frequently spend weeks treating what they believe are dental problems or muscle issues while their underlying heart condition continues to deteriorate. Heart related jaw, neck, or back pain typically occurs with exertion and subsides with rest, and is often accompanied by other symptoms like fatigue or sweating. Symptom number 5, nausea or indigestion. That persistent stomach upset you've been treating with antacids could be your heart sending a life or death message. Research indicates that 39% of women reported experiencing nausea, indigestion, or stomach discomfort in the weeks leading up to their cardiac event. Yet the vast majority initially treated these symptoms as digestive problems. Women describe persistent nausea without clear triggers or experiencing what feels like the worst indigestion of their lives that doesn't respond to usual remedies. Some report a nervous stomach that never settles or sensations of fullness completely unrelated to food intake. Your heart and stomach are connected through the vagus nerve system. When your heart muscle is deprived of oxygen due to blocked coronary arteries, the stress signals can travel along these nerve pathways and manifest as gastrointestinal symptoms. Essentially, your heart's distress is being translated into stomach problems through your body's interconnected communication system. Heart related nausea and indigestion occur with physical exertion or emotional stress, don't follow typical meal related patterns, and frequently occur alongside other subtle symptoms like fatigue or shortness of breath. The danger lies in the fact that effective heartburn medications can provide temporary relief from heart related digestive symptoms, creating a false sense that the problem has been resolved. Next, symptom number 6, anxiety or a sense of doom. That overwhelming anxiety or feeling that something terrible is about to happen might be your nervous system responding to your heart's inability to supply adequate oxygen to your body. Studies found that 35% of women report experiencing unusual anxiety, panic like feelings, or an inexplicable sense of impending doom before their heart attack. This isn't ordinary stress or anxiety. Women describe feeling like they're going to die without any logical reason for this fear, suddenly developing claustrophobia or panic attacks when they've never experienced these before, or feeling trapped even when everything in their life seems normal. Your brain requires a constant supply of oxygen rich blood to function properly. When your heart's pumping capacity becomes compromised due to coronary artery blockages, your brain begins to receive inconsistent oxygen supplies. This triggers your body's fight or flight response, even when there's no apparent external threat. Your nervous system floods your bloodstream with stress hormones like adrenaline and cortisol, creating physical anxiety sensations such as a racing heart, sweating, trembling, and feelings of dread. But because there's no obvious external cause, the experience feels inexplicable and deeply unsettling. What makes this symptom particularly dangerous is that anxiety is often dismissed as a psychological rather than a physical problem. The anxiety related to heart problems has distinctive characteristics. It often occurs suddenly in women who don't typically struggle with anxiety, feels different from normal stress responses, and is frequently accompanied by other physical symptoms. Moving on to symptom number 7, lightheadedness or dizziness. That lightheadedness you've attributed to standing up too quickly might be your brain signaling it's not receiving adequate blood flow due to your heart's declining function. Research indicates that 39% of women experienced episodes of lightheadedness or dizziness as acute symptoms during their heart attack. Women describe feeling like they might faint during normal activities, experiencing persistent lightheadedness without obvious cause, or feeling like the room is spinning while sitting still. Some report feeling disconnected from their surroundings or having moments where they feel like they might collapse without warning. Your brain consumes approximately 20% of your body's total oxygen supply, making it one of the most oxygen dependent organs. When your heart's pumping capacity is compromised due to coronary artery disease, your brain is among the first organs to signal distress. The dizziness is literally your brain's way of telling you it's not receiving the consistent blood flow needed to function properly. Women often blame dizziness on dehydration, low blood sugar, hormonal changes, or aging. Heart related dizziness often occurs with physical exertion, may be accompanied by shortness of breath or chest discomfort, and can progress from occasional mild episodes to near fainting or actual loss of consciousness. Next, symptom number 8, sweating without exertion. Breaking into cold sweats while sitting in air conditioning or finding yourself drenched during activities that never made you sweat before is a significant warning sign. Research shows that 39% of women reported cold sweats as an acute symptom during their heart attack. Women describe suddenly feeling like they're having intense hot flashes, even if they're not menopausal, or breaking out in cold sweats that seem to come from nowhere. Some feel clammy and cold while simultaneously sweating profusely, or sweat so severely during minor activities that they need to change clothes. When your heart struggles to pump blood effectively due to coronary artery blockages, your body activates its sympathetic nervous system, triggering stress hormone release that causes sweat glands to become hyperactive. Additionally, when your heart can't pump blood efficiently, your body's temperature regulation becomes impaired. This sweating often occurs in combination with other cardiac warning signs, creating a cascade of symptoms that women frequently misinterpret. It can be one of the warning signs of a cardiac event, and many women report that their sweating became more pronounced with increasingly minimal triggers. Finally, symptom number 9, chest discomfort. Everything you think you know about heart attack chest pain is probably wrong if you're a woman. Studies found that only 29.7% of women experiencing heart attacks reported chest discomfort as a warning sign compared to the classic crushing chest pain typically described in men. Instead, women describe feelings of pressure, fullness, squeezing, or burning in their chest. Sensations so mild they're often attributed to heartburn, pulled muscles, or stress. Women describe feeling like someone is gently squeezing their chest or like there's a heavy weight pressing down. Some report burning sensations that feel like severe heartburn. Women describe the chest discomfort in terms like aching, tightness, and pressure, not pain. Women's coronary arteries are typically smaller than men's, and they're more likely to have microvascular disease, which are problems with the tiny blood vessels that feed the heart muscle. This creates different pain signals than the large artery blockages more common in men. Unlike the constant severe pain of a typical heart attack, women's chest discomfort often comes and goes over days or weeks. It may be triggered by physical exertion or emotional stress and then subside, creating patterns that seem more consistent with minor problems than life threatening cardiac events. Research shows that the lack of significant chest pain may be a major reason why women have more unrecognized heart attacks than men or are mistakenly diagnosed and discharged from emergency departments. These 9 silent symptoms represent your heart's desperate attempts to save your life. The groundbreaking research we've explored today shows that 95% of women experience these warning symptoms weeks before their heart attack. Yet, the vast majority dismiss them as stress, aging, or minor health issues. Remember, these symptoms rarely occur alone. Heart attacks in women typically present as a constellation of subtle signs that build over time. If you're experiencing several of these symptoms simultaneously, especially if they represent a change from your normal health patterns, don't wait. Advocate fiercely for yourself and demand the cardiac evaluation you deserve. Don't let anyone dismiss your symptoms as stress, anxiety, or aging. Trust your instincts. If something feels different about your body, listen to that inner voice. As Dr. McSweeney's research shows, women need to be educated that the appearance of new symptoms may be associated with heart disease, particularly if they have known cardiovascular risk factors such as smoking, high blood pressure, high cholesterol, diabetes, being overweight, or having a family history of heart disease. Share this vital information with every woman in your life, your daughters, mothers, sisters, friends, and colleagues. Make sure they understand that recognizing these symptoms could mean the difference between life and death. If this video has opened your eyes to the silent dangers that millions of women face, if it's equipped you with knowledge that could save your life or someone you love's life, please type helpful in the comments below. Give this video a thumbs up to help us reach more women who desperately need this information. Share it with everyone you care about and subscribe to our channel for more life-saving health content. Thank you for taking this crucial journey with us today. Remember, your heart is worth listening to.